So let us begin with today's Allen's keynote study streak, and this is a remedy which we are going to discuss, which is a combination of some elements of arsenic, some elements of pulsatilla, and some elements of excessive catarrhal discharge, which is what we see in Dalcamara also, or all the catarrhal remedies which have a lot of weakness. So the remedies Hydrastis canadensis. The first line which Ellen has mentioned is for debilitated persons with viscid mucus discharges, cachectic or malignant dyscrasia with marked derangement of the gastric and the hepatic functions broken down by excessive use of alcohol. So all those cases, it can be the second or third stage of the condition which you are dealing with. It can be pathological condition or a condition which has progressed from functional changes to pathological changes, and it shows that the person is, you see that the person is weak, he is becoming consumed by the disease, there are a lot of catarrhal discharges. In those cases you can think of hydrostasis. The very nature of discharges should point you to understand the stage of the disease and how the disease is progressing in the individual from the functional to the pathological. There is a transition. So if you have a remedy which has thin nasal discharges, watery in nature, it can be more of the beginning functional stages of the disease, whereas thick mucus discharges which are of bad odor, they can be something that is more related to the pathological stage of the disease. In those cases you can think of Hydrastis canadensis where there is viscid mucus discharges. Now there is next line which is mentioned cachectic or malignant dyscrasia. This indicates that there is a tendency of the disease to change from you know just pathological affecting one organ to pathological affecting the entire body or maybe multiple organs. In such a situation, we should think of Hydrastis as a very strong remedy. You will see that there is profuse discharge of thick yellow stringy mucus, ulceration after mercury, chlorate of potash, and syphilitic angina. Pains of cancer before the ulceration sets in. So it is the stage where things are going to turn like a storm. It is the stage before the storm which is going to affect the patient. If you are able to catch that very easily, you can pick out and give Hydrastis to such a patient, and it is going to help them vitally. For me, it is a remedy which is more like having a lot of weakness like arsenic and symptoms of pulsatilla. Next you have is nursing sore mouth, tongue is large, shows imprint of teeth. When you read that, there is a characteristic feature of the tongue which was discussed in many other remedies before, like the imprint of teeth. This has been discussed in lot of remedies before, one of them being Merksol. In Merksol, there is mentioned that there is excessive salivation and the tongue shows imprint of teeth, and in the bracket you see there is Chelidonium, Podo and Rustox. So if you remember it from your previous read of the Materia Medica of the Allen's keynotes, it will make your job very easier to prescribe it in conditions where you see these features, and this is going to make your job easy because Allen is a book which is going to aid you in daily practice from acute, subacute to chronic cases, debilitated cases, even cancerous. If you know how to use it, how to pick up the keynote symptoms from the book and match it with what the patient is telling you, or vice versa. So you have in Hydrastis, there is a person who is hawking yellow discharge, viscid mucus from posterior nares. So the very nature of discharge and the seat of disease, which is the posterior nares, should help you understand that this is a disease which has affected the patient since so many days, and now the patient is reporting after doing some home remedies or some other medicines which he took without any much benefit, and now he has approached you. Posterior nares cough, yellowish discharge, thick, and there is ulceration after the primary stage or after mercury which has been taken by the patient. It can be some medicines or some ointments to apply, or some chlorate of potash, which the antibiotics or any other local gargles did, which the allopathic doctors give. In those cases you can think of Hydrastis. There is a condition which is also mentioned, syphilitic angina, for the throat condition basically. Next we have is for the female reproductive system. Where can we think of Hydrastis? Leucorrhea, ropey, thick, viscid yellow, hanging from the os in long strings like Calibicromicum, and there is pruritus. So this is a confirmatory symptom. You will need to ask the patient what is it that affects you in that sphere, and is the discharge which is very thick or ropey like. If there is a confirmation in positive sense from the patient, you can think of prescribing Hydrastis as a very strong remedy. Cancer of the breast, hard, adherent, skin mottled, puckered, knife like pains, sharp cutting, nipple retracted. So, as I started in the beginning of this session, that this is a remedy which you should think of when the pathological state has set in, or the pathology is advancing to multiple organs. If you are able to pick that up, your prescription for Hydrastis is very much simplified. It will not confuse you where you should give, how you should give. You should understand from the physiological point of view, from the pathological point of view, and from the materia medica point of view. So this is all about Hydrastis. Interesting fact, it is which all we all know, but we often ignore to read or understand. It is a remedy from the Ranunculaceae family, the remedy of the family of Pulsatilla and staph. So now you know these yellow discharges are the characteristics of the Ranunculaceae family, and this is a remedy which is given in extreme states of the functional disturbances, or the states which are bordering towards pathology. Maybe one organ is involved or multiple organs are involved. So that's it about Hydrastis. If this session has helped you, drop in the comments so that I know that it is helping you all. And keep keep subscribed or stay tuned to upcoming videos which are going to be very interesting in the long run, for practical use of different books in your clinics, practical use of how you should see these remedies in your clinics, and what the patients are going to tell and how you will interpret in your clinical homeopathic practice. So that's it from me right now, and tomorrow and day after tomorrow, for the next 4 days we'll have a break because of some commitments, but we'll resume with the Islands Keynote study streak with the new set of remedies from Monday onwards. So that's it.